Welcome to Live with the Eczema Doc, brought to you by Clean Body, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. Today, we are talking about a really important topic if you have eczema, because steroids are the main treatment that we are being given. We are going to be talking about moving beyond steroids today. Now, if you follow me, you know that I talk a lot about how do we heal eczema from the inside out? So I'm talking a lot about gut and liver and all of these root cause issues that are really internal in our system. And these are definitely at the root of eczema. But today we're going to go a different route. We're going to talk about how do we deal with eczema topically while we are actually working on that underlying root cause. So today we're going to really delve into what topicals can you use and which ones are actually effective if you're not going to be using topical steroids or other types of conventional medications on the skin. So today's topic, I know everybody is really interested in this because people are always like, how do I get more immediate relief? And yes, there are natural topicals that we can use that can provide more immediate relief. And we're going to talk about those today. Now, what we're going to talk about first, though, is why do we need to look beyond steroids, beyond calcineurin inhibitors? Why do we need to do that? Because there's a really frustrating cycle that happens. We apply those steroids, those calcineurin inhibitors, the skin improves, and then we stop the treatment, the skin flares, and this just repeats and repeats. This has probably happened to all of us. Anyone here who has dealt with eczema or psoriasis or any inflammatory condition, really, we're dealing with using these conventional medications and we just have to keep using them over and over again. And there really isn't a long-term solution here. What is the problem with steroids? They provide short-term flare control. They give us that fast relief from the redness and itchiness. But do they treat the root cause of eczema? No, not even in the slightest. And then we have this cycle of we apply, improve, it stops, it flares. This repeats forever and ever. Then we do have some long-term side effects, including skin thinning. We have the risk of something called topical steroid withdrawal. When you stop those topical steroids and all of a sudden you get this rebound effect where you have redness and burning, and this is all over the body sometimes, and it is very difficult to treat. And unfortunately, sometimes we aren't told the risks of topical steroid withdrawal before we actually start using topical steroids, and then we end up in this place, and we want to try to avoid that, okay? Now, what are the problems with calcineurin inhibitors? These are not steroids, and so they don't have the problem of skin thinning. They are safe for your face and your eyelids, so you might have been prescribed these types of medications for these very sensitive areas, but they still do not address the root causes. We still have this problem of applying and then it improves, you stop, and then it flares again. And there are some unfortunate side effects that we want to be a little more cautious of. The FDA black box cancer warning, this cancer warning is not confirmed in humans, but it's something we want to pay attention to. And then sometimes people report burning and stinging on applications. So we need a better way. And the question is, are there topicals that can actually address some of the root causes of eczema? And that is really the question we want to answer today. My answer to that question is yes, there are. Let's dive into the topicals that we can use to actually give us relief and also address the root causes of eczema. Okay. So when we're thinking about the root causes of eczema and when we're actually thinking about how can we address those root causes topically, we want to think about three things. So microbial dysbiosis. What does this mean? We have good bacteria, bad bacteria. We have microbes like yeast, and some of these are supposed to be on our skin and in our gut. And some of these are actually, when they overgrow, they can actually be dysfunctional and they can cause flares. We can have immune reactions to these bugs. And so that's what microbial dysbiosis is. Barrier dysfunction. When we have a weakened barrier, you do not hold on to moisture on your skin, and you can actually leak a lot of toxins and environmental exposures into your skin, which can cause the last one, which is immune dysregulation, which is an overactive immune response. And this is where we get chronic inflammation, AKA eczema. Okay. So my approach when I'm using alternative topicals is to actually compound these topicals with a compounding pharmacy and really target the driver. So if I find that somebody has microbial dysbiosis, they have maybe an overgrowth of yeast or bacteria, and we'll talk about those in a minute, then I might choose specific ingredients to put in those compounded topicals. If I think it's barrier dysfunction, if this is a baby or a child or an infant, and this started right at birth and we're noticing, okay, we see eczema in the family line, this might be genetic, then okay, I might use something for barrier dysfunction. Okay, so we want to really customize these formulas, and that's how we get them to work very well and potentially even better than your steroid medications at lowering symptoms and also treating the root cause. Okay, so now when we talk about microbial dysbiosis, we want to break down two really important microbes that are growing on your skin. And for eczema, there are two that really come up. And the first one is a fungus called Malassezia. It's a fungus or a yeast. And the problem with this is actually we don't talk about it. We mostly talk about it if somebody has seborrheic dermatitis, which is a type of eczema. But in people with eczema, not necessarily categorized as seborrheic dermatitis, 65% of adults have a Malassezia problem. 27% of children have a Malassezia problem. And what's the problem with this yeast? Okay, so it can be growing on our system, but there are certain species that tend to activate your immune system, causing an allergy to this yeast. Okay, so this is something we can actually test for. When you have a Malassezia overgrowth, this actually can overgrow more in a barrier that's really weak. And that could be weak because of your genetics. It could be weak for other reasons. And then you can actually have more of this problem as you are scratching and opening that barrier even more. And then it just creates this self-perpetuating cycle, right? And so then you get more and more inflammation, then you get more and more Malassezia growing, and then it just keeps going and going. And a lot of our conventional treatments don't necessarily treat Malassezia. Our next microbe that is very important, I'm sure a lot of you have heard of this one, called Staphylococcus aureus. And this is a bacterial microbiome driver. And you might have heard of this if you had a staph infection. That's how people usually hear about this. But often, Staph aureus is actually one of the main drivers of eczema on the skin. So Staph aureus is found on 70 to 90% of eczema lesions. And on healthy skin, we're seeing less than 5%. So we know that this is a driver of eczema. And Staph aureus does produce what are called super antigens, and this drives the immune response into overdrive, okay? And that's all eczema is your immune system just going crazy and haywire. This worsens with severity, so the colonization rate rises when you have a higher disease severity. So if you have moderate to severe eczema, we're going to most definitely find Staph aureus if we're doing a microbiome culture. And atopic dermatitis patients or eczema patients are 19.7 times more likely to be colonized with Staph aureus than healthy controls, okay? This is a bacteria you need to learn about and you need to know about, and you need to know what can I do about it. One of the most easy topicals that you can use is called hypochlorous acid, and this really targets Staph aureus on the skin. Now, the great thing is your body actually naturally makes hypochlorous acid, and these neutrophils or these cells in your body actually release it naturally to kill pathogens. So it's really a simple way, inexpensive, something that you all can access. And as I mentioned, 70 to 90% of those eczema lesions have Staph aureus. So if you have eczema, there's a good bet that you might be able to use hypochlorous acid and see some improvement. So 73% of eczema patients report reduced itching within 72 hours in a 2018 clinical study. And it kills Staph aureus pretty quickly. As soon as you spray that on your skin, within 3 minutes of topical application, you want to be using it frequently, potentially up to every 4 hours if you are feeling like it's improving things. One of the conventional ways of killing Staph aureus is to use antibiotics. And the great thing with hypochlorous acid is we're not going to get any antibiotic resistance. This destroys bacteria and the biofilms directly, and the pathogens actually cannot develop resistance. So this is a really great tool. At Clean Body, we sell a product called Clean Skin Calm. I usually recommend for my eczema patients, get 3 bottles, put it in your gym bag, put it on your nightstand and in your kitchen, just wherever you can to be spraying this, because it actually does reduce the itch. And it can be treating the root cause, which doesn't just reduce the itch in the moment, but it can actually reduce long-term. Okay, so this is a great one to consider. Now, if you're working with a naturopathic doctor like myself, then we can do a little bit more and we can compound topicals for you. So one of my favorites to address both Malassezia and Staph aureus is a topical called zinc pyrithione. And you might have heard of this in anti-dandruff shampoos. So this is really common, and actually the cause of dandruff is also Malassezia. So that's why it works well for those anti-dandruff shampoos. But we can actually use this topically, and we want to go with a really low potency because sometimes it can irritate the skin. And so this is why it needs to be compounded. Also, this has medicinal action. So you can't just necessarily get a cream with zinc pyrithione off the counter. Typically, this does need to be compounded by a doctor. And what's great about this is it is a broad spectrum bactericidal. So it will affect Staph aureus, but it also affects Malassezia. So it's a 2-for-1. It's really awesome. In a 4-week eczema study, zinc pyrithione normalized the microbiome, which means it reduced staphylococcus better than non-antibacterial moisturizers. And the same ingredient actually addresses also Malassezia. So this is so awesome, right? And again, just like the hypochlorous acid, we don't get the antibiotic resistance risk. And we're going to look at a case in a moment where we use this on an infant. In studies, we see that the benefits last beyond the treatment period. And so we don't have to keep using the zinc pyrithione. Often we just use it, and then after the period where the skin gets better, we stop and we don't see a return of symptoms. And this was in a study. It outperformed steroid creams and tacrolimus in post-treatment improvement. So this is a really wonderful tool if you're working with a naturopathic doctor like myself. And not all naturopathic doctors know about this, but this is something that we can compound in a pharmacy. And so this is that study that I was talking about. After stopping all treatments, the zinc pyrithione group actually continued to improve. The steroid group got worse, and the tacrolimus group got worse. Okay, so the baseline here is zinc pyrithione addresses the microbial root cause, not just the symptoms. And so this is what I'm talking about, using topicals that actually address the root cause, not just treating the symptoms of inflammation where then everything comes back when you stop. So how do you know that zinc pyrithione is good for you? If you get itchy on oily areas like your scalp, your eyebrows, your nose, your chest, if you have a lot of scaling in those areas, then zinc pyrithione could be a good option. If you have suspected yeast, you might need to do some testing to understand that or to work with a practitioner. And if conventional treatments have failed because those steroids or calcineurin inhibitors are only lowering the inflammation and not really addressing the reason the inflammation is happening, then we can see that even when you're using those treatments, your symptoms are still not getting better. And if that's happening, then you might want to search deeper for suspected yeast on the skin. And then long-term maintenance. So if we use it and the cause is treated, then our skin gets better. All right. Now, vitamin D is interesting because we always see these levels are lower in eczema patients. I see vitamin D levels as low as 5s and 10s in a lot of my eczema patients when I run these on blood tests. And where we want the vitamin D to be is closer to around 50 to 75. And so this is really important, especially in children. This is strongly linked to severity of eczema when we have low vitamin D. So first off, I typically recommend with my patients, get your vitamin D tested, get out in the sun, take vitamin D orally. But now we want to think, can we actually use vitamin D topically? We have found that yes, we can. Vitamin D topically can strengthen the skin barrier, it can calm inflammation, and it can support your skin's ability to fight yeast and bacteria. Now, we have seen that high-dose vitamin D creams can sometimes irritate the skin. So we want to really compound vitamin D at the right concentration and combine vitamin D with other ingredients to help the skin to heal faster. Animal studies do show that topical vitamin D reduces eczema inflammation and skin thickening when combined correctly. So I love vitamin D, and I actually love pairing vitamin D with zinc pyrithione, and we'll see a case where I did that in a moment. So next, we're talking about B12. There's actually pretty good research here. Vitamin B12 topically can calm the skin, the inflammation, redness, etc., without suppressing your inflammatory markers. So this reduces those inflammatory mediators, but it doesn't suppress a steroid does or a tacrolimus does. And so that can calm the itching, and it's very safe for long-term use. And I do use this even in infants. So in a placebo-controlled trial, we saw significantly greater improvement. 50% plus rated it good or very good in terms of lowering the eczema severity and eczema symptoms. So it was B12 versus a moisturizer, and it substantially reduced that eczema severity over several months of use. And multiple studies have actually consistently shown that B12 can reduce overall eczema severity across diverse patient groups, and that's actually important. So I like to use B12 if someone has a lot of inflammation, a lot of redness. Even in a TSW case, I might use B12 because it can vasoconstrict all that redness that's happening in a TSW case or topical steroid withdrawal. And then there are two other B vitamins that I really love. So B6, which is pyridoxine, and B3, which is niacinamide. And B6 is really interesting because what we have found is that there is a key protein called filaggrin that really helps hold our skin barrier together. And what we found is that people with eczema actually have lower amounts of filaggrin, and they do potentially, and not every eczema person, but some eczema people do have a genetic variant which causes them not to create this protein, and that causes the barrier to actually be very weak. So we might see if there's an infant or a child with eczema, maybe it has to do with the barrier. Maybe this baby was born with a less than optimal barrier. So what's cool about B6 or pyridoxine is that it improves protective ceramides. And you might have heard of ceramides to use topically on the skin. This is a little bit different. This is actually helping your body to create those ceramides. And it works along with vitamin D and B12. So I like using them all together. B3 or niacinamide has multi-action. So it's a great one. You'll actually see niacinamide in a lot of cosmetic products out there. It calms inflammation, reduces itching, strengthens barrier, and retains moisture. Now, how do we pick and choose these topicals, and how do we optimize? And we have to really understand what the root causes are. So testing is important. We can do testing for your skin microbiome, your gut microbiome. We can do vitamin D testing. We can test for allergy to that yeast, Malassezia. And all of that can help me to build a combination of ingredients that will help to target whatever you're dealing with. If you have a lot of inflammation and itchiness, we might use B12 plus niacinamide. If you have that oily flare, that oily area flare where you get a lot of flakiness. And so we think that Malassezia is there, or we test that Malassezia is present in excess, then we might use zinc pyrithione with vitamin D. If there's severe itching, there are more ingredients that we don't have time to go into today, but there's an ingredient called topical naltrexone that we can use for severe itching. So no single ingredient works for everyone. We do personalize it in my practice when I'm working with people. And I am trying to use these to both lower inflammation, to give the patient some immediate support, but also to address those drivers. I talk a lot about the drivers that are inside of our body and how do we heal those from the inside out, but we can use topicals to help heal faster. And this can be a really great tool that we use when we're going through this healing process. A lot of people ask me, so Dr. Fong, okay, what products can I get? Can I get these over the counter? And yes, you can actually find topical B12, for example, over the counter, and that can work well. Unfortunately, though, some of these over-the-counter products have oils that if you have a Malassezia overgrowth, that might actually feed your Malassezia. So there are oils that feed Malassezia. Malassezia loves to feed on oils and sweat. And so when you are using B12, if you're using the over-the-counter product, you have a Malassezia problem, you might then get a worsened reaction. And you might think that's because of the B12, but it actually might be because of the oils that are in that product. So you can find some of these, but it might still not be the right product for you, and it might not be the right concentration. It might not be the right combination. The base might be full of fragrances, preservatives, emulsifiers that irritate your skin. And we need to personalize this to you. You can think about trying some products over the counter, but you may not be getting the same results as if we compound those for you and personalize them. So let's talk about some cases. Let's go into a 9-month-old, and this is a real patient story. And if you want to see the testimonial that this woman did for us, it's on my YouTube, which is at Clean Body Health. Or if you're on Instagram, just DM me and I'll send you the link to this story. So this 9-month-old had severe eczema on her inner arms, ankles, and multiple body areas. It was bright red, itchy, and wounded, and it was constantly itchy. And the whole family had sleepless nights. Everybody knows this. If you have a kid with eczema, you know that nobody is sleeping. Multiple treatments had already failed, and this baby was also born via C-section, which means that she did not get the good microbes from mom's vaginal flora because she was not born vaginally. So she did have a poor microbiome that we uncovered. We wanted to go internal and work on the microbiome internally, but we also wanted to give her some relief because this family was having such a hard time, not sleeping, so itchy, 14 days. And we saw that with the use of topical B12, topical B6, and vitamin D, we see that day 1, there was severe redness and scaling. Day 4 and day 7, we see improvement already. And day 14, we actually see near complete resolution. Now, that doesn't mean that was the end of our road working together, but at least this topical had provided some relief for this family. And then we continue to do work internally to work on that gut microbiome. And as we can see, if you guys are watching this, we worked together from November 2020 to February 2022. And this mama says, my girl is free from eczema, 2 years of perseverance, dietary shifts, topical vitamin D, and gut support. And if you're watching this, you can see the shift between redness and scaliness on the back and on the ankles, and it's completely gone. We also did some internal things. We adjusted the diet. We worked on the microbiome, and that was a big one because this child was born via C-section. And This next story is a 5-month-old. So this 5-month-old had cradle cap, thrush, eczema on the forehead, neck, back, and arms. We saw a lot of scaliness. So cradle cap, everyone, is really similar to dandruff or seborrheic dermatitis in adults. This is actually caused by that yeast called Malassezia. And what we also see is, you'll see in a minute, mapping on the skin. And so if anyone has eczema and you see like continents on the skin, I like to call that mapping on the skin. Constantly unbearable itching, sleepless nights as well for this family. And this child was also born via C-section, so also had a poor microbiome. And that poor microbiome leads to yeast just overgrowing. So if you're an adult and you ever have taken antibiotics and you end up with a yeast infection as a woman, this is really similar. We see the before where this 5-month-old basically had little continents all over her body, on her neck and on her arms. And with a topical support as well as internal support, and we did use topical zinc pyrithione and hypochlorous acid, we see improvement and complete resolution here. And then that cradle cap that we see on the forehead and the scalp, and we see it's completely clear. And then on the back, again, we see all this mapping and completely clear. So what did we do? We did not use steroids, topical vitamin D, topical zinc pyrithione. That zinc pyrithione is safe for that little one. We're using it at such a low concentration. And we adjusted the diet of the breastfeeding mother, and we did the microbiome support for mom and baby, okay? This is just a little peek as to how do we address the drivers of eczema. And I know we always talk about those internal drivers, and addressing the external drivers as well can be super helpful. So how do you know if topical compounded medications are right for you? If you want to reduce or avoid long-term steroids, if you want to treat your face, eyelids, or sensitive areas, and you really want to get to the root cause, because a lot of those areas can be due to that yeast overgrowing. If you're stuck in this cycle of apply, improve, flare, apply, improve, flare, and if you don't want to use steroids or even calcineurin inhibitors anymore, then this might be something to consider. And if you have eczema in really oily areas like your scalp or your nose, that could mean that there is a Malassezia overgrowth, and this could be a good option. Now, one thing that we are developing at Clean Body that I'm so excited about is a clean skin microbiome test. And so definitely, if you're on Instagram, follow me for updates. Follow me on YouTube as well, so that you can know when this comes out. Because if you have eczema, this might be a really helpful tool to help you to understand, is Staph aureus really growing? Is Malassezia really growing? Should I be avoiding these oils like shea butter and jojoba oil and olive oil, and pretty much all of the oils which feed Malassezia? The list of oils that you can use if you have Malassezia is very short. So, if you're using these oils on your skin and you notice more flares, Malassezia might be overgrowing. How do you really understand what the drivers are for you? I like to start when I'm working with people in my practice with something called an eczema clarity visit, because I think the first thing we want to get is clarity, right? We want to understand, why do we actually have these symptoms, and what are we going to do that's not steroids, that's not calcineurin inhibitors. So what we would do is review symptom patterns and triggers, identify root cause drivers. Think about what testing might be great: organ health testing, skin microbiome, gut microbiome, hormones, toxic load. And then think about, are compounded topicals the right option as we're working on the internal system, okay? So if you want help figuring out what's driving your eczema, just DM me if you're on Instagram. DM me the word clarity, and I will ask you a few questions and help point you in the right direction. If you are not on Instagram, you can shoot us a message at info@cleanbody.health, or just check out our website at cleanbody.health. Thank you for joining Live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers, or download my free eczema relief guide for quick, quick, practical tips to calm flare-ups and help with your sleep. If you found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.